Peripheral arterial disease is a process where plaque and blockage formation forms within the blood vessels that supply blood to the extremities, such as our arms and legs. We see a lot of diabetic patients that have peripheral arterial disease, patients that are smokers, patients that have high cholesterol levels and hypertension have higher rates and prevalences of peripheral arterial disease. So those are the typical patients that we see. But occasionally we see patients that are completely asymptomatic and might have a few risk factors who have really significant peripheral disease that needs to be diagnosed and treated promptly. We're seeing this occur in a lot younger patients. And so sometimes I see patients present in their 30s that have significant arterial disease of their legs. We want the patients that smoke cigarettes to stop, and I know that it's a very difficult task, but it's just intrinsically related to formation of PAD. We want our diabetic patients to be under excellent control of their diabetes, get screened for all of these different disease processes, because the bottom line is we want to prevent heart attacks and strokes, as well as prevent limb loss and amputation associated with this severe PAD. We can actually put data into a computer program and give an objective percentage of what your likelihood of having a heart event is after we assess the patient's risk profile and try to modify that as best we can, is to really get into ways of restoring blood flow to the extremity. When you go upstairs, or if you walk up an incline, or your legs aching, do you have cramping in your calf muscles? If this is going on, that can be one of the classic signs of PAD. And the most severe and extreme presentations that we see of PAD are those that have wounds or sores on their feet or toes that have been there for a long time and not seeming to get better. Some other symptoms of PAD might be less obvious than the pain. Fatigue of the legs, coolness of the extremities. If the patient noticed that their leg hair is disappearing, that might be a sign of PAD. We can actually go into the artery and take a little picture of it through a minimally invasive procedure called an angiogram. After we do an angiogram, there are lots of ways we can treat that vessel with this minimally invasive procedure. We can clean out arteries. We can use balloons that stretch the artery on the inside and get rid of blockage. We can actually scrape the blockage out of the inside of the arterial wall and remove it from the body. So there are lots of ways to restore blood flow to the extremity without having to make big incisions or without having to do an actual surgery